Good evening and thank you for joining us for the electronic referrals to the Sydney Local Health District and the Southeastern Sydney Local Health District Prince of Wales Hospital pilot. My name is Alex Dolezal and I am the Digital Health and QI team leader in Central and Eastern Sydney PHM. I would like to start tonight by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognize the continuing connection to land, water and community and pay respect to elders past and present. I'd also extend that respect to any Aboriginal colleague who may be joining us tonight. I would like to introduce the presenters in the sequence which they will be presenting. Joe Burdajevich, Principal Policy Officer, Ministry of Health. Arun Subak, Project Manager, Digital Health, Southeastern Sydney Local Health District. Arun has over 20 years experience with deploying key clinical systems such as ICU systems, ERIC, and imaging systems. Arun is also a former registered nurse, having worked as a vascular clinical nurse specialist, nurse unit manager, and senior nurse manager previously. Amy Blomfield, Senior Business Analyst and Subject Matter Expert, eHealth New South Wales. April Gosses, Senior Business Analyst and Subject Matter Expert, eHealth New South Wales. Paul Bennett, Program Manager, Health Pathways, Sydney and the Sydney Local Health District eReferral Project. With over 30 years experience as a registered nurse and health manager in the United Kingdom and Australia, Paul has been the manager of the highly successful Health Pathways Sydney program, supporting general practice since 2013, and is also responsible for the delivery of electronic GP referral system to the Sydney Local Health District hospitals and services. We have several more presenters joining for the Q&A panel. Siddharth Ramani is a project manager from eHealth New South Wales. Hannah Coffey is eReferral Project Officer, Sydney Local Health District. And John Christophe Meunier is the National Manager Health Services, Healthlink.
My name is Joe Burdajevich. I'm the Principal Policy Advisor for Ambulatory Care at New South Wales Health. My role involves giving policy advice for outpatients and hospital in the home for all those clinics across New South Wales Health. So today, this session is primarily around the introduction of eReferral to GP clinics within your local areas. This is I guess, a great opportunity for us because it's the start of some change across New South Wales, because at the moment we are pretty much still very much a paper-based system for our outpatient clinics. So if I just go through what our eReferral solution is, to the left you will have your practice management system and Healthlink, who is our vendor, who has integration with best practice, medical direction, Genie, MedTech, SLHD and Zedmed. So the opportunity for GPs to do an eReferral there, and then for that to come across in a secure message across to the New South Wales outpatient clinic that you're referring to. For the purpose of tonight, we're particularly talking around clinics in southeastern Sydney and also some in Sydney Local Health District. So without going into too much detail, part of the solution is for us at New South Wales Health Clinics to be able to receive those referrals in a paper, not in a paper-based form, but in an electronic form. So we're able to receive, screen and triage in one place in a digital platform. And I think what is a real advantage is to close off some of those black holes that we sometimes hear about, especially from GPs and patients, to say, I've sent my referral, but I don't know what's happened to it. So with our new system called Engage Outpatients, what happens is the referrer and the patient are now getting a text message or an email according to their preference of communication, letter if required, to say that we've received the referral. And also then once it's triage, to actually say what the outcome of that triage is, whether we've accepted the referral, whether it needs to go to a different clinic because we can't meet that need, or whether that person will be getting an appointment shortly or in a little while. So this is a system that I guess will really help to digitize what we do and for us to really move away from fax, which is the primary way that outpatient clinics still receive referrals across New South Wales Health. So thank you. Next slide. So tonight, I guess, primarily is around eReferral, and I just wanted to talk to you a little bit about the eReferrals forms design approach, because I think it's been a really strong way that we've done this in a true co-design way. So when we've developed forms, rather than just looking, I guess, at one side of what the clinical content is, we've really worked with clinicians, but also GPs, so that we get a referral form that meets the needs of both the clinics, but also those who refer. So we've had form focus groups, which we've invited people with their clinical specialities. So that's involved admin and clinicians, approximately 95 members for the forms that we've done already. Once that form is done and we have the clinical content for that form, we then work with what we've called a primary care reference panel. We set up this panel to recognise that GPs all work in a very different way, whether that might be a small practice, a big co-located clinic, depending what different platform you use, etc. So we have that primary reference care panel to sort of give us a rounded view of, does this form work for you as a GP user? And that's been really powerful for us. And I think what we've discovered is clinics often would like a very big amount of information from a GP, and GPs are saying we have a time limit and there's just so much information. So we really drill down to what is the most important thing that needs to come across from the GP as a referrer across to the clinic, so that referral can be triaged appropriately with enough information so that that referral can be seen in the appropriate clinical timeframe. We have a project team who review the technical feasibility and develop the form together with Healthlink, and Healthlink, who is our partner. Many of you already know Healthlink if you're not using them for eReferral at the moment. They also are the provider for referrals to Roads and Maritime Services for driving assessments. So just in terms of our design principles, we're adhering to principles of patient-centred care. We've developed based on clinical indications, so really understanding what's the clinical information that we need to know for clinics to make the right decision about how urgent that patient may be. It aligns with the New South Wales health policies and guidelines, which are the documents that we, or the policy that we set. And really that policy is around making sure that people have access to clinics in this timely possible way. So really to support that we're moving and actioning referrals in a timely manner. And the decisions are based on a consensus. And where we haven't been able to get a consensus, we've met with different groups to try work through up to the point that we do have a consensus. So we've had 4 forms developed and tested, and to do that, that's occurred over 8 focus group meetings and 4 primary care reference panel sessions. So really making sure that we work between those 2 groups to make sure that we have forms that GPs will want to use and that work for you to be able to transfer the information you need in the most efficient way. Thank you. So just in terms of eReferral benefits, so the real advantage is that there's a near real-time transmission from GPs with that acknowledgement. So there are no lost referrals or delays. So we really hope to close off that we don't know what's happened to the referral, or those scenarios where patients say, my GP sent the referral a couple of months ago, and then when the clinic looks for it, they're not able to find it. So really making sure that we know straight away that it's been received and actioned. There's no cost to deploy. The switch on an entire referrer base is overnight, so it's something that's very simple to enable in your practice. It's fully integrated and supported by all leading GP software vendors. The copies of the referrals are auto-saved and stored within your GP clinical software, so you can find that referral when you want to refer to it. And we're really looking to eliminate error-prone and expensive manual referral processes. So really not wanting GPs to have to do faxes or to really try stop that back and forth when a clinic says we don't have enough information, we need this or we need that, and then it comes back and forth, and there's a level of inefficiency but also delay for the patient. We want to support faster communication and continuity of care between healthcare providers and support fast intervention and better health outcomes so that patients are triaged and seen in their correct clinical timeframe. So I've just given a very quick overview about, I guess, why we've started on this journey, and then I'm going to hand over to the next team member to walk you through, and I think that's you, Arun, to talk us how this looks in southeastern Sydney. Thank you.
Thank you, Jo. So as Alex introduced me, my name's Arun Supag. I'm the LHD project manager. The 4 slides I'll be covering is the pilot scope, the pilot timelines, the services that are included in the pilot itself, and what we're doing in terms of the steps moving forward. So this slide just covering the pilot scope. Initially, eHealth and Ministry of Health asked for expressions of interest for the participation in the EO pilot, and our LHD put their hand up and we submitted our EOI in September 2022, and subsequently our pilot started in March this year. Prince of Wales Hospital adult outpatients were selected, as well as outlier services that were included in the pilot. The reason Prince of Wales outpatients were selected is because they've got an existing eReferral system already from Telstra Health. However, this was a standalone system and it had no other plans to be rolled out due to the pending EO strategy that was getting rolled out by the Ministry of Health. So the further rollout of EO for the rest of the LHD is pending a business case in terms of moving forward. And just a little note there, funding was only provided for the pilot, and that's what we're proceeding with within this scope. Next slide, please, Natasha. So in terms of pilot timelines, as I said, the focus is on Prince of Wales adult outpatients. So the eReferrals and ERMS, which is the hospital-facing system, we're going to be deploying from the 20th of November this year. In terms of some of the approach that, or some of the components of the approach that we have undertaken, initially as I said, when we started in March, we started off with some information sessions. Then through April and May, we ran a number of workshops, which were planning discovery workshops. Then we proceeded to the build phase, which was mostly around the integration with EMR. Then in October, we finished testing, and we're actually starting our end user training as we speak this week, with the proviso that obviously we're getting ourselves ready for the go live from 20th of November. Next slide, please. So the services that are included, as I said, are centered around the outpatients clinic. There are 2 additional ones that are outlier areas, or a couple of additional outlier areas, such as spinal and palliative and supportive care. I won't read out all of it, but as you can see on the slide, they're the services that have been included in the pilot. Thanks, Natasha. So in terms of the next steps for EO at the LHD, as I mentioned, the funding was only provided by the program from Ministry of Health for the pilot, and that's what we have undertaken to try before you buy, as they say. The next steps will be a development of an options paper to work out and map out exactly what the best approach is for the LHD. Once we've picked the appropriate option, we'll develop a business case and submit that to secure extra funding. And just a little note there in terms of the scope of the exercise in terms of moving forward for the rest of the LHD, we're talking over 1,000 clinics, and the scope right now is only the ERMS system is only interfaced with Cerner EMR. So we'll be rolling out to those clinics that have got the EMR scheduling systems. Otherwise, all other clinics are out of scope for us at this point in time. I think that's it, Natasha, for me. Next speaker, please.
Thanks, Arun. My name's Amy Bloomfield, subject matter expert, and I'm working on the Engage Outpatients team. So as Jo and Arun, they've sort of provided a high-level overview of the eReferral system or eReferral forms. And so what we'd like to do is just show you a quick animation to give you a high-level view of the eReferral pathway from submitting at the GP practice management software end all the way through to being triaged at the LHD end. Thanks, Tash.
Does the new digital referral management solution work?
When a patient visits their doctor and a referral is needed to attend an outpatient service, the referrer can view and select an outpatient service from the directory. The eReferral is sent via secure messaging to the outpatient service. The outpatient service receives the referral and a notification is sent to the referrer that the referral has been received. Clinicians in the outpatient service can review and triage electronically, anytime, anywhere with a New South Wales Health Network connection. The referrer and patient receive a referral outcome notification by email or text message. The referral outcome is based on clinical urgency. Outpatient services can monitor and access reports of referral volumes to better manage capacity and demand.
Thanks, Tash. So what we'll do now is I'll just take over and share my screen, and we'll do a demo of one of the eReferral forms. Okay. So as Arun and Joe have mentioned, that Healthlink are the vendor for eReferral forms and are integrated into GP practice management software. So within that software, there will be a launch toggle that can be clicked upon to launch the site. So in this case, to send a referral into Southeastern Sydney, the GP will log into New South Wales Health Outpatient Referrals Southeastern Sydney. Their menu won't look as busy as this one, as it's just test data. So what we'll do is we'll provide a demo of the endocrine form. So where a endocrinology referral is required to be sent for a patient, the Healthlink form will be launched from the patient's the practice management software. And in this case, it's Prince of Wales Hospital that are going live with this form. So in regards to the forms, it doesn't matter what specialty form is being selected. Each time it's launched and opened, the form will look and feel the same to ensure usability and orientation of the form, so that things are always in the same place and it's easier to use and adopt. The first tab is the key information required to submit a referral that's specific to that patient and that condition. The second tab down here on the left is specifically designed to include additional information or attachments, and that might include pathology results, medical imaging results, or additional specialist reports, so they can be selected and attached to the record. Medications, allergies, and alerts will be auto-populated from the practice management software with the ability to add additional notes down below here. So it's really important that the practice management software information is current for the patient. The same applies for the medical, social, and family history. However, in this case, the GP will select what's appropriate to be submitted for that referral type, recognising that someone who may have been to the same GP for 10 years may not require the whole history to be included. The patient information demographics is also auto-populated, and that will include Medicare information, Indigenous status, contact details, and postal details. And then the last tab is the referrer information tab, which again is auto-populated based on the credentials of the user. And that will include essential information such as the referral details and creation date, as well as the Medicare provider number of the referrer and the practice details. And this ensures the ability that we can provide secure messaging when the referral is being sent. So in the case of an endocrinology referral, the GP can go in and there'll be an option to select a clinician that works in that clinic. I don't have the form live to show, but there will be a drop-down list of clinicians who can be selected to make a named referral to. There'll also be the option to make an unnamed referral to comply with Medicare requirements. There's a couple of key mandatory items, many of which are auto-populated or defaulted for you to try and help facilitate the completion of the form in a timely manner. But just a key points include that in the majority of cases, you'll be submitting a new referral, so that's defaulted. And there's the odd occasion where you might want to provide an updated piece of information or to indicate that it's an ongoing referral and it's required because a previous one has expired. It includes the referral validity period, as well as the ability for you to indicate your clinical sense of urgency for that referral. If a referral is urgent and rapid access is required, there is a prompt that a phone call to the receiving outpatient clinic is required, and the conversation documented below. For every form, you'll notice here that there's a Health Pathways link, and that Health Pathways link will take you to the relevant health pathways for that specialty. So in this case, it would take you to the South Eastern Sydney Health Pathways Endocrinology specialty page. The GP will then indicate what the reason for referral is. So we have here a handful of selections of umbrella terms for which a GP might want to send a referral into. There is the ability to type into, and there's some smarts that the form can find the condition for you. In the event that a referral may not fit specifically under one of these identified umbrella terms, there's also the ability to indicate that it's an other endocrine condition. For example, if the GP wanted to send a referral in for adrenal insufficiency, they would make that selection. And then from there, there's some direction as to what is actually essential to be included in this referral so that when it's received by the LHD, they can undertake a clinical triage without requesting further information. So in this case, we have some blood tests and some basic information that's required to help support that referral. The form asks whether all the referral information has been included. If in the event that it has not, for example, you may have requested the blood test results and the patient might be going to get them done that same day, you can actually add that information to say that results will be obtained through a certain provider, if that's known. There's the ability to include a narrative, as well as the ability to include previous consultation notes. So if the patient has presented for the same condition, then that can be included in the referral. In the box for additional referral information, there's an information icon, and that is additional information that is helpful to be included in that referral. It may not be essential to undertake clinical triage, but it would help provide context and help assist the clinician in identifying a clinical urgency. This information box will change depending on the condition or the reason for referral selected. So in this case, for adrenal mass, there is no additional referral information that's been identified. However, these items have been identified as appropriate. Again, just highlighting here, if it's appropriate, recognising that we don't want to delay referrals inappropriately. There's some generic questions regarding the patient's considerations, risks or barriers for accessing care. And that might include whether or not they're the primary contact for that referral or whether they require a carer or guardian, whether an interpreter is required, whether any reasonable adjustments are required, and if there's any other considerations, risks or barriers to accessing the service. And that might include basic information such as that the patient has an NDIS package, that they've got an aged care package or an advanced care plan, or anything relevant to that individual that you're submitting a referral for. Here, the measurement details, including blood pressure, body mass index, height and weight, again, are auto-populated from the practice management software. So when these tabs have been completed, the last requirement is that the patient is consented to make sure that they're comfortable that a referral is being submitted digitally on their behalf. The form does allow you to park the form. So if for some reason you've started the form and you get interrupted, there is the ability to park the form and come back later. I just wanted to call out here that there is some work to improve the updated process. So at the moment, if an LHD does request additional information, once a referral's been submitted, then you'd come back into the form through the practice management software. You'd indicate that the referral is an update, and you would include the mandated items, which would be for adrenal insufficiency. You can include whatever information's been requested, and then just make a note to say that the additional information has been provided. I'll hand you over to April now, who will go into the GP notifications.
Thanks, Amy. Good evening, all. I'm April Gosses, one of the senior business analysts working on the e-referral forms with eHealth. Next slide. So we're just going to talk a little bit about the notification aspect of the Healthlink system. So one of the great benefits is that we are able to instantaneously message back to the referrer if additional information is required, like Amy touched on. So we just wanted to provide some examples of that so you kind of get a feel for what that looks like. So here we have 2 reasons that we may send a notification back to the referring GP. So you will actually get a message to say that we've received the referral, so that one up the top. Or you may get a message that indicates that we've placed a referral on hold, and that's generally because we're requesting additional information or we need to clarify some patient information. So it just kind of brings you along the journey as to what's happening with that referral. This is what the messaging looks like on the LHD end. Next slide. Just 2 more examples there. So you'll also receive a notification when the referral's been triaged with the triage category. So that top referral there was indicated that the patient will be seen within 90 days to let you know that that referral's been triaged and completed. The patient also gets some notification in regards to that. And then the last one there is if a referral was cancelled. So for instance, a referral sent through, patient then decides they no longer want the appointment. So that one there says that it was withdrawn by the patient. You'll also receive notification to keep you in the loop. We go to the next slide. So this is actually what it'll look like within the GP's practice management system. So within your notifications tab or section of your practice management, it'll display a list of the patients that have come through with notifications, and then over to the right, just a bit of a outline as to why that's been put on hold. So for instance, this one was incomplete. We wanted some further diagnostic investigations, and they're looking for pathology results. So like Amy said, you would go back into your Healthlink, create an updated referral, attach that requested information and send it through with some updates coming to that functionality, which should be live early next year, which will make it a little simpler. Next slide. So we're coming to the end of the Southeast Sydney part of the presentation this evening. So here's just some contacts or some further resources if you wanted some extra information or to read further about anything. If you've got any questions, alternatively, you can contact Sid Romani, who is the eHealth project manager, or Arun, who is the project manager for Southeast Sydney. Thank you.
Thank you, April, and good evening, everyone. So I'm Paul Bennett from Sydney Local Health District. So next slide, please. Thought we'd just give you an opportune update on what's happening in Sydney SLHD in terms of eReferral. As most of you know, we've been running Healthlink eReferrals for a number of years, including the pilot for the Engage Outpatients platform for New South Wales Health at our Women's and Baby Services. So to access Sydney SLHD services via Healthlink from your practice software or the My Healthlink portal, you have two options. So that in yellow is to our antenatal services at RPA, Canterbury and Concord Midwifery Group Practice. And then on the green side, which is just Sydney Local Health District, you will find the remainder of our other services. There's about 65 connected services at this point in time. Next slide, please. And then you'll get a sense of what services are actually currently receiving eReferrals and transacting back to general practice with those referrals from there. Next slide. And coming up over the summer and into autumn periods, we have a number of services coming on live for the first time. So that includes eating disorders, endocrinology at RPA, diabetes right across the district, so to all three clinical centres for diabetes, as well as additional services then of existing forms for hand therapy, high-risk foot services, the introduction of the positive FOBT direct access colonoscopy service at Concord, as well as the addition of sleep at Canterbury and the new short stay hernia service at Canterbury Hospital. So all of those will be coming on stream over the coming months, as well as further revisions to existing forms. Next slide. For those that have issues or aren't fully connected to using Healthlink from their practice software, just a reminder to our maternity services, we accept fax referrals with a cover sheet because they actually land on the Engage Outpatients platform. So this is for downtimes and difficulties with transmission. We request that you use one of these cover sheets alongside your standard referral information. So, but as you said, we're only in the event of downtimes or if you are not a connected practice at this point in time. And at any point, if you have difficulties in connecting to Healthlink or you can't see Sydney Local Health District services in your Healthlink portfolio from your practice software, please reach out to us. Next slide. And myself and Hannah Coffey, we're available Monday to Friday between 8 and 5. Our numbers are on the board there. And not to forget that the Healthlink customer care help desk can also help out with numerous support issues, and they'll escalate to us. And not to forget the strong support that's there from the PHN digital health team, Alex and the rest of the team there can also offer support in accessing eReferrals and Healthlink system. And that's it from me. So thank you. And I'm going to pass back to Alex, I believe.
It is about if the referrals have to be named. Who would like to, which one of the presenters would like to answer it? Would it be some, Martina, you're talking in general or are you taking a particular health district, just so I know where to direct the question?
There is an option to make a named referral and also leave it as an unnamed referral within the drop-down. So when the form goes live, you'll see a list of clinicians associated with that particular clinic. So you can either select that or leave it as an unnamed referral. And this is in line with the Medicare requirements.
Can I just ask Paul Bennett, would it be the same case in Sydney Local Health District or would it be different?
That should be the same right across health in Australia. So general practice is more than within its rights to make an unnamed referral to the department. The hospital services do prefer named referrals for the benefit that that's then helps support services and fund outpatient activities across the district. So all patients should be should be questioned on their preference of how they want to be billed by their specialist or the specialist teams. And on occasion, there may be, at patient's behest, the opportunity where the service will come back to the general practitioner if the patient has requested a named referral. So, but certainly unnamed referrals are certainly an option.
Thank you, Paul. I've got another question. If in case of named referrals, does the patient see the clinician named in the referral?
So yeah, yes, on the receiving end, the clinicians will be able to see that this is named referral to Dr. X. They'll be able to see that.
Okay.
But I think the question is, oh no, does the patient see the clinician named in the referral?
The patient, oh, sorry.
Yeah, so Martina, I don't think the patient doesn't receive a copy of the referral unless they would ask for a copy to be printed for their records. So they may not see the name of the thing, but I guess we're hoping that there's a discussion between, as Paul said, between the patient and the GP in regards to, you know, this is the clinic and these are the options and who that doctor would be.
Okay, thank you. I do have another question from an anonymous post. The doctors got several patients who live away from local area, and the problem is I could not refer a patient who lived in North Shore area, but I work in Southeastern Sydney Local Health District. Will the link work in future for other local health areas?
Yeah, so we're doing a statewide rollout, and at this point, it's with Western Sydney and SESI. And over the next year, we're rolling out with a few other LHDs. So over a period of time, you'll be able to refer to multiple, facilities across different LHDs.
Thank you, Sid. Paul has put his hand up.
Yeah, thank you, Alex. And further to what Sid was saying, certainly the Sydney LHD forms have always been available to Southeast Sydney based general practitioners, and they are now available right across New South Wales. And the hope is that all of the various LHDs, when they come on board, would do similar, because most particularly the metropolitan local health districts provide tertiary services right across the state. So it's vital that our colleagues geographically out of area can access those forms. And we've seen that over the last couple of years, where we've received referrals from all the way from the Queensland border to the ACT and down to Eden and equal distances west. So, and they have been for patients that have been appropriate to be referred. There will still be instances where patients may get bounced on geography if there is an applicable service in the same suburb as that patient. And I think that's only fair when patients are kind of pushed back for those reasons at this point. It's about availability of service. But for most of us, provide tertiary services for all of these forms that are available now.
Thank you, Paul. I've got another question, and that's anonymous. What if the GP does not have a compatible clinical software? What's the solution there?
Organisations that need to refer into any of the LHDs or to do any other type of smart form that doesn't have one of those practice softwares that was listed. There is also the My Healthlink portal that can be registered for. That's a free registration service that you can apply to online with Healthlink. All the details will be provided in the support material. I'm sure that the team will be emailing out after this. But if you don't use one of those practice softwares listed that does integrate with Smartforms, you can also do the Smartforms, but through the My Healthlink portal.
Thanks, JC. I've got two previous questions which were answered in the chat, but I will just read them out again, just in case some of the participants have missed them. There was a question during the demonstration. She asked why it said 3 reports were selected, but no files were attached. So that was during the demonstration of adding those additional attachments. Sid or JC, who would want to talk to this one?
Yeah, look, the system that has been shown today was purely for the forms workflow, not necessarily the integration into the GP practice software environments. As you know, there was half a dozen or so practice software integrations that Healthlink has supported. So we weren't actually able to go into each of those individual practice softwares to show that detail. So that form workflow was purely from a demo system, not necessarily the live environment. If in case you have any concerns or questions or queries around your particular practice software and the Healthlink integration, you can always contact us free or have your practice manager contact us if you are having any of those issues, and we can certainly help and try and resolve those.
Thank you, JC. And about one of the problems with Healthlink referrals is that they're not captured within the patient notes in the best practice software. Can you talk to that, or will you have to escalate this to one of your help desk staff?
Yeah, I'm not quite 100% on what that question is relating to. So Healthlink Smartforms and the integration we have within each of the practice software systems can only occur from within the patient record. You cannot launch Healthlink and you cannot use the Smartforms unless you are actually a licensed user of your practice software and you are inside a particular patient record. You've launched a particular patient in your electronic medical record. So there's no, I'm not sure if that's what the question is asking about, but certainly the integration is deep within the patient record of the software.
Thank you, JC. I do have two questions which are very similar about will the Sydney Children's Hospital Network also use Healthlink in the future, or will they use ConsultMed? I'm not sure who's the most qualified to answer to this question. Has also mentioned, what about the Sydney Children's Hospital? They recently rolled out their own complex system.
I can take that, Alex. So for the moment, Sydney Children's Network have opted to go with ConsultMed, and that's really to cater for their market of a very high flow of specialist to specialist referral rather than GP to specialist referral, due to the nature, I guess, of the service that they offer. So for the moment, it is ConsultMed for Sydney Children's Health Network. I guess, what does the future hold? That's really hard to predict at the moment. Things will change in the New South Wales health landscape with a single digital patient record, which is now on the cards in the coming years. But unfortunately, at the moment, I guess we're still in a situation where we have some different systems across the system, and we appreciate that that's difficult for GP referrers, but for the moment, that's how it's landed. In the future, there may be opportunity for some sort of integration between the two systems, but that really would be dictated by availability of funding. So I think for the moment, the answer is really that Sydney Kids will be using ConsultMed going forward at this point.
Thank you, Joe. Any more questions? I will read out a testimonial which was posted by one of our doctors, and that was Dr. Annabelle Kane from Askenville Doctors, who's a very prolific user of Healthlink Smartforms to the Sydney Local Health District. And in fact, Dr. Kane said that the smartphones in the Sydney Local Health District, which she's been using for a number of years, are extremely very user-friendly system. In fact, so much so that it is becoming a bit annoying if she is now trying to refer to a clinic which does not have eReferral. So that's a very good feedback from her, and she also appreciates the feedback via Healthlink from the clinic to say if the referral has been accepted, not accepted, and what would be the reason for not being accepted. So yes, that's a testimonial from one of our GP practices and a doctor who's a heavy user of the Sydney Local Health District eReferrals. Will the smartphones align with the SRCs?
Martina, what a good advocate of statewide referral criteria you are. So thank you for raising that question. For those GPs online who may not know about statewide referral criteria, it's another key project from the Ministry of Health, which is a clinical decision support tool to help GPs determine which clinic is appropriate for patients and I guess what the threshold is for them to come to an outpatient clinic. It also gives us criteria in terms of consistent triaging so that patients across New South Wales are triaged in the same way. So the first SRC that we've launched this year have been launched for ophthalmology and gastroenterology. And yes, Martina, the SRC have gone into the gastroenterology form. I don't think we've finalised an ophthalmology form yet because none of our clinics are going live with ophthalmology at this point. But the plan is that we integrate those SRC into forms. And obviously the partnering work that goes with that too is that health pathways are updated accordingly as well. So ideally, we really want three things to align beautifully: the health pathway, the standard referral criteria, and the eReferral form, so that it's really seamless for the GP to know what does the clinic do, what patients do they take, how do I refer and make sure that my patient has, comes to the right clinic for the first time, and that we triage in a consistent way across the system.
Thank you, Jo.
I also just wanted to add on top of Jo's comment there, Dr. Gleeson, just in relation to the workflow which Amy provided in the demonstration. As indicated, the design of criteria such as the statewide referral criteria or other referral guidelines will flow the exact same way as what's being presented here in the demonstration today. So that's part of the standardization approach and the collaboration that we've had with all of the clinicians and general practitioners as part of this implementation.
Thanks, JC. And there's two more questions, and I think you would be answering both of them. Is asking about the forms in best practice software. She mentions that the referrals sometimes show in the Healthlink tab rather than the Documents Out tab. Can you talk to this topic, or you will have to leave it to one of your help desk team?
I'm not quite sure what Dr. Leeson is talking about there in terms of those tabs, but certainly in terms of where the information is that you want to attach to a Healthlink referral, those will typically all come from your documents and your reports. So when you receive information in from a number of different organisations, might be your bloods or your radiology, etc., for various different patients, those will all be stored in key sections of your patient's medical record in your software. So however you're receiving and storing those will essentially be then made available. So just make sure that some of those things, as Amy said earlier, around medications and the like, just make sure all of those things are being stored correctly in your clinical software so that the data can be easily transferred once it needs to be sent on to another organisation to manage the care of that patient. It's really critical. Okay.
And I also have additional questions from anonymous attendee. Our practice use medical director. Where can I find a GP notification where the eReferral has been triaged or need further information or waiting period?
That will simply come in. I'll take that one again. Alex, that information will simply come in where your other notifications will come in. So as I just mentioned around receiving your pathology results, radiology, where you get your discharge summaries, where you receive any other clinical correspondence in terms of what comes in your inbox. I think Medical Director has a holding file or an inbox. Essentially, the notifications from the referrals that you've sent through, your eReferrals, will come back into that same inbox, that electronic inbox for the practice via the secure messaging.
And there was additional comment from Dr. Statis. As stated before, there must be a way to save the referral in the file for transport, and I'm assuming that this is being the Roads and Maritime Services fitness to drive assessment. We print, then scan, in which takes longer than faxing and shredding.
I don't know if that's a comment for me, but certainly from the integration Healthlink has within any practice software, the submitted referral will auto-save to the patient's record. So maybe I'm not understanding what the process is, but maybe that's a comment in terms of maybe what used to happen. I don't know.
I will also put another one from someone who is anonymous. What happens to the correspondence from the clinics to the GP? Do they come through the Healthlink? And I think you've answered this before.
Yep.
It goes into the holding file or inbox in best practice. Okay, I think that's all of the questions. So I would like to thank you to all of the presenters. I would like to thank all the attendees for participating in tonight's webinar. Please complete the online surveys that will pop up in your web browser, and we look forward to seeing you online soon.